Welcome. We're going to go ahead and start our Pixels of Production virtual session, our small ruminant session. Very quickly, we have a committee of approximately 10 or so of us. It fluctuates a little bit. And right now, I'm just going to give you the quick rundown. We've got Heather Conrow, who is our chair. We have, as members of our committee, Alexis Stumpe. We have Amy Schleicher. We have Brenda Schreck, Chloe Collins, Chrisee Brandl, myself as tech support, Karen Funkenbusch, and Shelby Jenkins. So some of us are on the call tonight and we'll be able to assist with other questions. Feel free to reach out to us at any point. So tonight's speakers, we have two fantastic speakers tonight. We have Dr. David Brown, who is our small ruminant extension specialist for the University of Missouri. And we have Dr. Charlotte Clifford-Rathert, who is a retired veterinary medical officer with USDA Veterinary Services and also a DVM. So I'm going to go ahead, I'm going to turn it over to David. And we'll get started with the presentation. I'm going to go ahead and turn off my video so that I'm not in the way, but feel free to take it away.
All right. Thank you, Dr. Cory. All right. Good evening, everyone. And I hope you can hear me clearly. Thank you so much for the invite tonight. Actually, I was actually supposed to be presenting to Pixel Production last year at Southwest Missouri, but I think that event was canceled. So to me, it's a great opportunity to come tonight and talk to you and for us to interact together. And like Dr. Cory said, my name is David Brown. I'm the sheep and goat specialist with University of Missouri Extension. I'm based in St. Clair County, Osceola. I've been on the job for about 1 year, going to 2 years right now. And I've got 30 minutes for this presentation. So I'm going to move a bit very fast, but I'll try and speak very slowly because I could talk very, very fast, and please, in case you have any question, feel free, like she said, to interrupt me and put your question in the chat box, and then we can get engaged and let's see how far we can go tonight. Thank you. Next slide. All right. So the first thing I want to ask tonight, which is a basic thing, is of course the title of this topic is how to develop on-farm biosecurity, for sheep and goats. And I think to me this is very, very timely and very important. Dr. Cory just mentioned what she's been doing in the area of biosecurity. And of course, based on what we know, with the outbreak of avian flu, we cannot just take lightly the issue of biosecurity. So to me, like she said, prevention is always better than cure. So it's better to stay on the side of prevention than try to run helter skelter and look for solution when issues are out of our hands. So basically there are two words in the biosecurity which I would like to point out, which is a prevention and spread of diseases. So what we're trying to do is we're trying to keep out diseases, parasites and viruses and bacteria as much as possible out of our operation, and this is very important, so that we can have a successful operation when we can manage, effectively these diseases on the farm. And like I keep saying to people, it doesn't matter what size of your flock, it doesn't matter if you are a commercial operation or you're into just something very small, a beginner, it takes only one sheep to introduce a new disease and one farm to start a disease epidemic. So that's why the issue of biosecurity is not just only for yourself, but it's also for the other producers, in the state around us that might get these problems if we don't take care of our biosecurity. And this is not only limited to small ruminant. I know we have people here that are into cattle production. This cut across every operation of livestock, operation, so that we can minimize and manage, effectively the introduction of disease onto the farm. And also, I keep saying to people that biosecurity doesn't only protect your livestock. Of course, it protects your farm, the industry, and you. And we're going to be seeing that when I begin to mention the zoonotic diseases that can be passed, or introduced from animals to human beings. Next slide. All right. Biosecurity. Now, why is this important? This is a cornerstone of a successful enterprise. We can see from the diagram I put there, if you have good nutrition, your animals are well fed, good body condition, good welfare, good vaccination, whether you're into cattle, like I said, or you're into small ruminant, or you're into chicken, if these are in place, but your biosecurity is not in place, it will jeopardize everything you've put in. You could even have good genetics on your farm, but when you don't take, your biosecurity as very important, it's going to affect the productivity of the entire system. So that's why, biosecurity, and we can see from the planning wheel all these different operations we have. But if that biosecurity component is missing, of course, it's going to undermine everything you do. So that's why it's important for us to take this very, very important. Thank you, Dr. Cory. All right. So just I think a few days ago, and Dr. Charlotte is here. I attended USDA IFI's webinar, just about I think 3 days ago or last week. I'm not sure. And they try to give us an overview of the avian flu in the country. And to my surprise, I look at this figure and I see that about 150 flocks have been affected since February of 2022, and that occurs about 50 states all the state in the United States. We have about 1.3 million birds that are also affected. So that's why it is important for us to take cognizance of biosecurity in our operation. And of course, I mean, I think last year we had for the first time, and I know, things happen for the first time. We have a very young goat in Minnesota farm, come down with avian flu, which has never happened before. And so that's why it is very important for us to be mindful, of biosecurity on our farm. Next slide. I got this picture while I was trying to prepare for this presentation. I think I love it. This gives us a something graphical to look at when it comes to the destructive impact of biosecurity on our farm. This is a farm in Australia, and of course, all these animals, have to be killed, and they have to get rid of them because of the biosecurity issue, the threat they pose to other animals, and to me that amounts to economic losses, and of course that leads to increased production cost. There's going to be market price in some of these products if we have to, get rid of these animals, just like we see now in poultry. The eggs are very, right now it's coming down, but some few months ago very expensive, and these are the impacts these can have either on your cattle operation or your small ruminant operation. So you want to be, that's what I'm trying to emphasize the importance of biosecurity on our farm. Next slide. All right. Now, basic biosecurity concept. And I call this basic because sometimes basic things are often overlooked. The simplest things I love this quote. It says the simplest things are overlooked, and yet it is the simplest thing that are most essential. Even though they look or sound so basic, some of the time we tend to overlook them. Sometimes we tend to like, oh well, but those small, intrinsic, basic things are very, important, and it makes a difference between if a successful enterprise and whether your enterprise will fail. That's why I want us to, take note of those basic biosecurity concepts. It might be like a reminder to you. It might be something you need to enforce on your farm, but it's very important we adapt to this. I visited a farm sometimes last year. I can't remember, maybe Alabama. I'm not sure right now. We were on the bus, and the owner wouldn't allow us to come down, because we're so mindful. Look, you could see from the picture, on this side, it has about 300 heads of goats and sheep, but then, and the operation was very successful because we're so mindful of biosecurity. And so the first thing we want to do is we want to limit visitors only to people who have to be on the farm. That's very important. I know some of us, we have friends and relatives. We have, other producers that are our friends, but it's very important that we only limit visitors to the farm, to people that have to be there, and it's recommended that we only have, one entrance and one exit for the farm. And, we should keep a good record of people in case you want to trace, where, possibly disease come from. You must keep a good record of all farm visitors, and this is going to help you as you develop a plan for your biosecurity, for your enterprise. Next slide, please. Thank you. All right. Now, you know that, and these pictures are not what I got from what these are real pictures that people sent to me, producers in the States sent to me, That's why I put some here, so we can see what's going on, when it comes to issue of biosecurity. So new animals are the biggest threat to biosecurity, and that most diseases walk through the gate. That's why, I say we need to limit visitors coming to the farm. And also, it's highly recommended that we buy from a closed flock if possible. Some people ask me, well, is this possible? Yes, it's possible. Of course, a closed flock is one which no animals are introduced. People tells me, well, what about inbreeding? With the inbreeding issue, when you have a closed flock, it's possible for you for a very commercial operation, you want to use artificial insemination, or rather you want to bring in a ram, and then of course go to quarantine the ram and make sure that it's not bringing in a new disease, but a closed flock is what we advocate for, where animals are introduced for at least for 3 years, so that you can minimize, the introduction of disease into your operation. And it's not recommended that breeding stock be purchased as sales done. Like we know, you don't know what the reason why the producer is selling the breeding the stock, and you want to start. It's good for you to go to registered breeders, or farms that maintain a closed farm, for you to be able to prevent disease into your farm. I have a question from Amy. If a farm would like to host let me see. Is that for me? One second, please. If a farm would like to host a group of people and let them see the farm, not just from the boss, how can they do so safely? So if a farm would like to host a group of people, and I'm working presently with Convoy of Hope, and we're having demonstration for the public. So I'm going to cover that. You want to make sure that they have some things. They can have some. I'm going to show that some covers to wear, and gloves and all those kind of a thing before they come in and there must be a designated area where they have to stay, before, know that they can move, and yet they won't be allowed to touch the animals. So these are the things which I also go to cover as I move quickly in my presentation. But that's a very good question. Thank you so much for that. So you want to examine your animals when you want to go and buy. Make sure you buy from a reputable breeder, that maintain a closed flock. Very important. And when you buy, there are so many things we can't see with our physical eyes, but there are some that we can check. Like you want to check for lameness, you want to check for like the picture, they want to check for CL, abscesses, sore mouth. These are things that we can visually see with our eyes before we purchase any animals, coming into our farm. Next slide, Dr. Curry. All right. Maintain a close flock or herd. Like I said, meanings limit new animals, only introduce males. Or if you have to, you only bring in males for breeding purposes when necessary. And of course, that male have to be quarantined for about two, recommendation is 30 days, but I rather do a longer quarantine period to be sure, that you are, to be sure that you're not bringing in a new disease into your flock. So, and the recommendation is if an animal leaves your farm, the animal is going to stay out of the farm. It should not come back to your farm. So that is a recommendation that we tell producers to adapt. Next slide. Thank you. Basic biosecurity concept, of course, keep germs away. I love this picture, and I got it from Dr. Cory Bromfield, from some of the things she posted on the ME Extension website. These germs, these bacteria, they are invisible with our physical eyes, So she gave us a visual representation of what it looks like. Imagine somebody coming to your farm in this kind of boots, carrying these germs and disease into your farm, and that could be the beginning of a big issue. That's why I put that for us to see. There are germs we can't see from with our naked eyes. So to what Amy said, when people are coming in, when I go for farm visit and I go to help, with producers, I go with my foot bath, I mean, sorry, with my pair of boot, and I put on something like, I don't know what's called. I just put it on just to be sure that I'm trying to protect, the farm and the owner, because I go, sometimes I could do two, three farms in a day, and I want to be careful of not bringing disease from one farm to the other. So I wear my a cover, before I move to the farm, and we also advise use a foot bath, with disinfectant solution. Dr. Cory and I wrote a guide sheet. And of course, from that guide sheet, you want to make sure you apply detergent and foaming agent to surfaces before cleaning. That's to rinse off all organic material, or debris from the boot, and that's so very important. So I recommend, if people have to come to your farm, they must have a shoe cover, and they must not be very close to the animal. That's very, very, very important. Next slide. All right, so I love this graph, and it shows us the number of line purchased, you know. And so what I'm trying to point out here is when you bring in new animals, you want to limit the number of farms you buy from to reduce disease risk. I work with a lot of producers in the state. Some people tell me where I want to go buy from three, four, five, six farms, and I tell them, no, it's better to buy multiple animals from a single source than single animal from multiple sources. The more sources you buy from, the more chances of bringing in new disease into your farm. And from this graph, you can see this cumulative probability of buying in lice, OJD, that's ovine unit disease, or foot rot. So the number of line purchase, the more you buy from different sources, the more risk you're exposing your animals to. That is what this graph is telling us. So if you want to buy, make sure you buy your animals from a single source that is trusted and credible. And also avoid bringing in new animals when your flock or your herd is most susceptible. Of course, when during the killing period or lambing, the immune system is low and it drops, and when the animals are pregnant, the immune system drops. So you want to limit, your bringing in new animals. You don't want to buy during this period when the immune system is very low. So that's very important. So the key point here is you buy your animals from a single source rather than buying from multiple sources. Next slide. Tips for acquiring. Okay, so we're still on the current the tips. Also, like I said, new or sick animals should be isolated or separated. Recommendation is 21 to 28 days or 30 days, but from this I've seen some studies that recommend a longer period, say 60 days, which is better, and I think that's I'm going to recommend that, and when you're bringing new animals, it's not only limited to just buying. When your animals go for show, or your fair or exhibition, we're going to be having that sometimes in August, July, August. Make sure that you treat them as if they're just coming into the farm. So when they come back, you must separate them for this period, and then you have to watch them for any sign, when they return back to the farm. And it's recommended that you use the less visited end of the band. Don't put them on the pasture. You want to just put them somewhere where they're not close to the burn. They mustn't have any nose contact with the other animals. And then this is a time for you to not to neglect, but to observe these animals, um for health indicators or for behaviors that are not consistent with the other flock. So that's very, very, very important. Next slide. And I thank you so much, Dr. Cory, for doing this for me. Um, I won't go too much into this because of my time. 722. Key behaviors. These are symptoms to watch for when you quarantine your animals, or when you isolate, or when you isolate sick animals, or when you quarantine. You want to see, if a new animal is coming to the farm, loss of appetite, excessive taste, lameness, diarrhea, and all these things. And these are the things you want to watch for before you introduce the new animals to the entire flock. This is very simple. Of course, we know a lot about the avian flu, and the one I said Minnesota was introduced, when the goats and the birds, the poultry, they share the same feed source and water source. That was how the goat was able to get infected with the avian flu. And so, as much as possible, make sure you prevent contact between animals and poultry. I was having this class in person sometimes, and someone asked me, I have a producer that has some end and the end fly into my pen. I said, well, I don't know what you have to do, but you have to make sure that you keep the poultry away. Make sure different species of animals are separated, particularly poultry right now that we have issues, so that you don't bring in introduction of avian flu into your operation. Next slide. This is very important. I work a lot with producers, and then people just call and say, well, an animal died. Sometimes people tells me these 3 weeks later, 5 weeks later. I tell them, where's the carcass? Say, where I dispose it of, I bury it, and this is so important. Once you notice a sudden death in your operation, you don't just discard and say it happens. You want to find out what is the underlying issue. Why is there a sudden death? Maybe in the morning when you go look at your cow or your sheep or goat, make sure you don't just discard. Make sure you reach out to veterinarian, reach out to extension offices. Let's try and get testing done on the necropsy so we can know this particular person I'm working with lost about 20 to 30 heads of sheep before he actually raised the alarm, and we send those things into to the hospital. So make sure you don't just bury it and say it's not normal. Timely disease investigation is very key, to your operation. Next slide. This question came up when I was having my in-person program, and people tell me, well, the placenta, my animal eats placenta, it doesn't matter. And I actually had to put this up to tell us that, we should not allow, our animals to eat the afterbath or the placenta. Very important, because they may carry infectious pathogens, And the new study from University of Maryland Extension, is a choking report. So this is a new study or new new information, beg your pardon, that this cluster may impose like a new a choking effect, So make sure you try um, and possibly just you want to dispose of, in a very you want to dispose this off. You don't want your animals to have access to these the afterbath, and it's a biosecurity issue, and it's a management choice because people argues this a lot and say, well, my animals eat their placenta, it doesn't matter. That's why I'm going to leave it to us, but I'm going to advise we do not allow our animals to have access to the placenta afterbath. Thank you. Next slide. I won't spend too much time. This picture was sent to me by my producer, and the one on the right with the dog, it was trying to show me, he didn't know what was happening on this sore mouth, and the next thing I said that make sure you wear gloves because some of these diseases are zoonotic, which means they can pass, from sheep or goat to human being, so when you're handling your animals, no matter what, just make sure you protect yourself and your family. Make sure you wash your hand very well. Make sure you wear protective clothing, gloves, and boots. And don't avoid eating or smoking or drinking the burn. Very important, so you don't get infected because some could be transmitted from animals, and that's at least from USDA, the one that could be transmitted, from sheep and goat to human beings. Next slide. I think so. These are the disease. The main thing, of course, the issue with I think Shelby keeps small ruminants. She's in this session. Of course, the main key issue with ruminant production is parasite. parasite is one big issue, and there's still ongoing research on how to minimize. We can't keep them away, but we need to minimize. So you don't want to bring animals that are very susceptible to parasite, to dilute what you've been doing for years. So resistant worms is real. It kills these, particularly the Baba worm. It kills the sheep and goat very first. So make sure these are the diseases you want to be concerned on your farm, particularly the first one on the list, like I said, is parasite, parasite, and parasite. Thank you. Next slide. This is my daughter, and I put the picture here because of I would love you to retain this information. We give back to my last daughter, 2 years ago. When I went to the hospital, was in Maryland, the doctor refused to let us leave. Why? Because she said we can't leave until we find a pediatrician that we administer, of course, the immunization. And we didn't know that, So we had to look around and make sure we get all verifiable until the release. I don't know if you have the same experience with us, And that was my daughter when we went to church, the petting zoo, with the sheep and stuff. I said that to say this, you need to develop a veterinarian client patient relationship. And I went to call a vet, that is Dr. Charles Stock. I don't want to, she's going to do a great job on that. So it's better for you to develop that relationship, and they help you to manage, your animals, than when you have issues, you don't know who to call to or who to run to. So find a veterinarian experienced in small ruminants or whatever operation you're doing, and schedule routine flock health check with your veterinarian. Thank you. Next slide. I'm almost finishing. Do you have a biosecurity plan? You must have a plan. It mustn't be on your head. It must be on a napkin. You must have full biosecurity plan, and you can create a biosecurity plan for your farm. That is the website, that you can go to. You can download that print, and I believe this record will be made available. Download that, and get to have a plan. It's so detailed from that website, and keep it and review that on a consistent basis. Next slide. 1 minute more. Next slide. Thank you. Okay, so I won't take too much of time. Why you should have a plan, I've said that, but look at the prevention. The green zone is your prevention zone. We will send out the link. Thank you so much. So your green zone is your prevention zone, and it's very good to keep it out because you're not going to be spending a lot of money. Your economic return is 1 to 100. That means for every $1 spent, $100 is saved in future losses. So it doesn't matter how much you spend on prevention, you go to gain it back, when it comes to your productivity and the profit at the end of the day. So I would love for us as producers to keep on the green zone, which is to prevention zone. I don't want us to go to eradication when the disease is already on the farm, but they're still manageable, So let's try and keep to the green zone without going to the yellow zone or the red zone. Next slide. Okay, this self-assessment biosecurity checklist, and it gives you a breakdown of what to do. I love this also, protecting your flock, animal health. They are breakdown how to protect your flock. There you have to take what you have to do. You take it. Animal health, you take vehicles and equipment. So this is also a good website, and the committee will make this available to us. I mean, these recordings, so you can go to that website and download self-assessment biosecurity for sheep operation. And if you fail to plan, you're finding to play. So make sure you plan so you don't fail to plan. Make sure you plan right now so you're not planning to fail. Beg your pardon. Next slide. Key take-home messages. Isolation and quarantine. Quarantine is very important. Keep new arrivals and sick animals separate to prevent disease spread. Disease prevention management, develop and update your biosecurity plan. I was going to say that we also do what I call on-farm assessment. So if you need help, please reach out to us or reach out to the committee. You don't have to reach out to me. We can help you develop your farm biosecurity plan. We can look at your risk level, and help you mitigate that. So you can please reach out to develop this fund. We can help you with that. And we are available to do that. Next slide, and I think that's the final one. All right, these are my references. And I think Dr. Someone sent me this, but contact is there. And thank you. I'm sorry I rushed this presentation. I really thank you for listening to me tonight. And I'm now going to take some few questions.
Fantastic, Dr. Brown. Thank you so much for talking about biosecurity in sheep. We've got a moment for a question. If we've got another question that anybody has right now, feel free to unmute, pop it in the chat. I was glad to hear that you have some recommendations that we don't have to necessarily hide the sheep away or hide the small ruminants away, but we can utilize boot covers, or we can put people on a bus to be able to see the animals without necessarily, creating a risky situation.
Correct. And Dr. Cory, like I said, the farmer that lost about 20 heads of sheep, I was able to go to the farm. We identified the risk areas, were able to help, and now the animals and the farm are doing well. So if anyone want us to come in person, we are willing to come and help with that plan.
Fantastic. Excellent.
My name is. Oh, okay. That's my wife. Oh, yes, she joined. Thank you. I'm sorry. She came to support me. I asked her to join.
Excellent. We're glad that she's here. All right. Well, I'm not seeing any questions right now, but if you continue to put questions in the chat, we can certainly ask them as the night goes on. After Charlotte's presentation, we'll have some more time for questions. And even if you don't get your questions answered tonight, feel free to send them to us and we can reach out and make sure that we get the right information. So let's see. Next, we've got Dr. Charlotte Clifford-Rathert. Sorry, I'm tripping over my words over here. Who's going to give us a little discussion about when to dial the dock. Charlotte, you ready to take it away?
Good evening, everybody. Thanks for attending. I see some names that are familiar and that I've known for quite some time. So tonight I was asked to talk about when to call the veterinarian. And so we're just going to go into that. Feel free to ask questions at any time. My presentation is pretty short, so feel free to interrupt me. So the first thing you want to do is contact a veterinarian or find a veterinarian that's willing to work with you on your small ruminants. You can do that by consulting with fellow producers. Go to network with folks at the fair, or go to breed shows and network with folks to see who is there from your area and that actually have a good rapport with a veterinarian that they like and appreciate. And that would probably be the easiest and most efficient way to find somebody. You can also utilize the American Association for Small Ruminant Practitioners website, as well as your local or the state veterinary medical website, association website. They usually will have lists of veterinarians and what their specialties are and what they prefer to work with. So you can locate a veterinarian that way. You can also elect to go and visit large animal clinics in your area and just see if there's somebody there that is interested in working with veterinarians or is actually specialized in veterinarians. I think a lot of new graduates are getting more and more interested in the sheep and goats and serving them as they're becoming more popular as a production animal. And also on the small urban farms, they're becoming quite popular as a pet or producing milk for the family. When I was in school, there were very few sheep and goat veterinarians. So that's what led me to specialize in sheep and goats, because there weren't any veterinarians in that area. And you can always schedule a meeting with the veterinarian once you find them, invite them to your farm, show them your farm, kind of introduce them to your management system before you have any issues. Usually they like to kind of get a feel for things, and this also helps create this VCPR, which Dr. Brown talked about a little bit, he touched on, and I'm going to touch on a little bit more. And then you can just exchange information and insights on your production and your management. Okay, next slide, Cory. Okay, so the veterinary client-patient relationship. This is something that you can do with just visiting with your veterinarian. The veterinarian agrees with you to establish a working relationship, and he will assist you with decisions to make, or you can decline according to treatments that's recommended. Veterinarians, in order to have this relationship, a veterinarian must examine the animal physically and determine proper treatment, share his clinical findings, recommend testing, follow-up treatment plan, the prognosis, and any related risks and costs. This is something that can't be done over the computer or with your cell phone initially. I have had clients that I know and I've worked with send me pictures, but only after I've established a VCPR with them. This is something that is regulated and required by law by the animal medical, oh my gosh, I'm losing it, the AMDUCA. It's the regulatory description of what a VCPR is, and it requires the licensed veterinarian to have this working relationship with clients or producers where he is familiar with their management plan, their farm, and their animals, and they can have this. This also allows them to prescribe off-label use of certain drugs, whether they be animal-based drugs and some human drugs to treat certain conditions. Since we've got so many regulations now on what drugs are available for people to use. Thank you, Cory. Animal Medical Drug Usage Clarification Act. Thank you very much. But anyhow, this is required in order for us to be able to prescribe drugs for you to use on your animals. As you've probably realized, there's very few antibiotics or anything available in the farm stores like they used to be. And so this allows us to prescribe that for you to use and keep a record of it. And you can terminate this relationship anytime that you're tired of the veterinarian or you disagree with what they're saying and you want a second opinion. You know, it's the same as if you have your regular doctor relationship. Okay, great. Next slide. Okay, so having a good relationship with your veterinarian, or at least for me, I appreciate producers that are very aware of what's going on with their flocks or herds. So it requires observation, be really familiar with your animal's normal behavior, know any unusual issues or behaviors that they're coming up with, like if they're off feed for more than a day, if they're slow coming up with the rest of them, or if somebody's lagging behind and fails to come up, you need to go look for them. There's different things that you need to be observing with their normal behavior. Keep records of all your vaccinations, dewormings, illnesses, treatments, death losses, basically when, how much, how long, duration, time, date when, if you're introducing a new feed or you bought new feed, sometimes it's important to know the date that you started feeding that feed. A lot of times this can come in handy if there's a toxic, an intoxication type issue with a feed additive or something. And I've only had that happen once, but it was really important. And it cost the producer about a dozen head of sheep. And so it was very costly, but it turned out that there was a supplement in the feed and it was 1 decimal point missed, and it turned out to be very fatal. But anyway, just that doesn't happen very often, but it can happen. Be sure you ask questions if you have an excessive death loss, or if you have sudden death losses and you don't have any explanation as to why. Your animals are healthy one day and the next day they're dead, then you need to ask your veterinarian to come to your farm and for a visit. Identifying reasons for animal deaths require necropsy and postmortem exams. A lot of times we'll take samples from the healthy animals to see if we can kind of head things off before they get even worse. This is something we do a lot with disease outbreaks, and avian influenza is a perfect example of this. Farmers see very few symptoms with avian influenza. They'll check their flocks at night, everything's fine. The next morning they wake up and they might have a 25 to 30% death loss. And then the next day they have a 75% death loss. So, you know, it can be, that might be a little extreme, but it can be, I'm watching Cory's expressions, but it can, but that's how it is. Sometimes it is like they've lost almost half of their flocks, and then they know what has gone wrong. And a lot of them have been doing preliminary testing, and the virus gets them between the surveillance testing. That's happened on a few farms too. So it's just always good to ask questions. There's never a bad question. And then just be sure you call your veterinarian in a timely manner. Don't wait until half your flock is dead. You know, like say, oh, I lost one yesterday, and then I lost two today, and then, you know, wait a week. I'll call in next week if I lose any more. You know, in the meantime, you've lost a dozen animals. Call your veterinarian in a timely manner. It's better to catch it before it gets carried away. Next slide. So when to make the call, just for some examples of things to watch for, like if your animals are off feed for greater than a day. I have goats, so they're temperamental. And I have does that I've had for 10 years. And there's some days where they just don't feel like eating, but they're totally normal otherwise. If they're off their food for a couple of days, then I get concerned and I start looking a little deeper. Bloat, choke. Bloat's probably more common in sheep. I've had a few goats bloat on me. I've not ever experienced choke in goats or sheep that I've recognized. I may have missed it, but it is something that could happen. Straining to urinate is common in males, so that would be an indication of a urinary problem, usually calculi in the males. And if they're straining to urinate, that constitutes an urgent call, basically, because that could be a fatal situation. Milk production drop, that would be an indication that your animals are not feeling good, and that's probably more noticeable if you're a dairy producer, a dairy goat producer, or dairy sheep producer. You'll notice the milk production decreases when your animals are ill. Animals not staying with the herd could easily have a fever or be weak for some reason. So those are easy things to kind of say, hey, yeah, I need to call the veterinarian. It may not be an emergency tonight, but see if the veterinarian can come out tomorrow during the day. Severe traumatic injuries like dog attacks, broken legs, those kind of things. Prolonged labor, this is a big one that I used to just get so frustrated with. People wait too long when their animals are in labor. Don't wait 10 or 12 hours. Try to bring them in. If they should be in hard labor for at least an hour, and then have their lambs or kids within 30 minutes of each other following the firstborn. So if they're in prolonged labor, usually the outcome's pretty bad. And you'll either lose the offspring or you'll lose everything. You'll lose the dam and the offspring both. So if she's in labor, say, you know, in the morning, and you come home at noon and she still hasn't had anything, then that's probably when you need to call. I wouldn't go more than 2 or 3 hours, basically. Severe lameness that lasts more than a few days. That's something you might want to call the veterinarian out if it's, as long as it's something more than just a foot trim. You know, foot rot sometimes can be pretty severe. It's best to pick that up early. I used to do a lot of farm calls for foot rot, and I used to do a lot of calls for just toe trims that I thought was foot rot, but it turned out to be toe trims. So anything out of the ordinary, and I'm sure I've left a lot off of this list that other people can think of, but anything that you notice that's out of the ordinary of your animal's normal behavior. Next slide, Cory. Unless there's questions. I don't know if there's questions or not. Emergency versus non-emergency, just like I said before, emergency visits are usually your life-threatening situations, traumatic injuries, animals are down and won't rise. That's usually a pretty good emergency because it won't wait till morning because they may not be there anymore. Straining to urinate for meals, like I said, is an extreme emergency. Prolonged labor, prolapses, respiratory distress, bloat. Those are all could be life-threatening situations. Make an appointment, other things that wouldn't constitute to be quite an emergency, but could like wait till tomorrow or the next first available appointment would be if they were off feed for no obvious reasons. There's a lot of things we could tell you over the phone to try to kind of hold on, and if we can't get out there the next day. For lamenesses like overgrown hoofs or foot rot, sometimes those can wait for a day. Diarrhea. Diarrhea is an acute situation, but it usually is due to a problem that has been going on for a while, like parasites. That's usually the number one diarrhea situation in sheep and goats is parasites. Well, it takes at least 28 days for that parasite to cycle through your animal. And usually those are management situations that I counsel people on when I used to make their calls for their parasite situation. So that's something that you can identify, and you could even bring samples to the office and speed up the process and run a fecal and then identify the problem and then come out the next day and help you treat it. Anything like wellness exams, vaccinations, deworming, castrations, a lot of those things producers can do on their own, and then there's a lot of producers that rely on veterinarians to do them. Those are things that can be made an appointment the next day or so. Next slide. I think we're pretty close to the end. So here are some resources for just general small ruminant information. I'd like you to introduce you to the American Consortium for Small Ruminant Parasite website. It's got the latest information for parasite control. The website for that is you can either type in American Consortium Small Ruminant Parasites or it's wormx.org. Or you can go to the Maryland Extension Sheep and Goat page, and there's a direct link to that. This page, as it says, it's a consortium for small ruminant parasites. There is just everything available on that website that has to do with parasites for small ruminants. They talk about biosecurity, they talk about testing. You can even become certified to do your own FAMACHAs if you wanted to be certified for FAMACHA. There's a course through the University of Rhode Island that you can do FAMACHA training on. There's instructions basically on fecal evaluations and treatments and different philosophies and the latest research that has been done on parasite control in small ruminants. There's also, yeah, and Heather says she uses this website all the time for sheep and goat questions. And it's a fantastic web resource. And there's also the small ruminant website for Missouri. It's srcrsp.missouri.edu. They have some good information on that. You can go to extension.missouri.edu. Lincoln University, which I used to be associated with as a state specialist, the small ruminant program, they have some stuff on their website. There's a book called Raising Goats for Milk and Meat by Sin and Rudenberg. That's kind of a producer's handbook for health issues. And then the Goat or Sheep Health Handbook. Oh, excuse my misspelling there, I guess. That is subtitled A Field Guide for Producers with Limited Veterinary Services by Thomas Thedford, DVM. That's a good handbook for producers as well. Next slide. and resources for veterinarians new to small ruminants. So these are some books that I recommend to new graduates as they reach out to me wanting to learn more about small ruminants. These are books that I carry with me all the time. The goat medicine book from Mary Smith and Sherman, Sheep, Goat, and Cervid Medicine by Dr. Pugh and Ann Baird. This is what I consider my Bible. I love that book dearly. The binding is broken and falling off of it. That's how much I've used it. American Association of Small Ruminant Practitioners. It's a listserv for veterinarians. I encourage them to join this organization. It is a wonderful resource where veterinarians can, regardless of how new they are to the field of small ruminant medicine, they can contact, just throw a chat in there or an email, and one of the more veterinarians that work with or specialize in small ruminants all over the country can help them and assist them with diagnosing certain conditions and that. And I have learned so much from that website, and I have been a member of that organization since vet school. So, and that's been a long time. I won't tell you how long, but it's been a long time. So anyway, but it's an excellent resource for new veterinarians. And then there's also, I have the American Consortium. There it is. There's the website for veterinarians too. That's a great website for veterinarians as well. And then I think that might be the next to last slide. Yep, there's my last slide. I appreciate you guys listening. And if you have any questions, I'd be happy to field your questions.
Fantastic. I see that Dr. Brown's got his hand raised.
Yes.
Hi, Dr. Brown. It's nice to meet you finally.
Nice to meet you too, and great presentation. Two things I want to just point out. First is a comment, second is a question. We also do pharmacy training with Lincoln University. I organize Fields Day every year, so I partner with Dr. Salinas and Dr. Archer. So we do pharmacy training and certification. So in case you want to do that, just reach out to the committee. They know how to reach out to us, and then we can do that training for any producers. I can use the card. You can use that card at home for to make decision on the woman. Dr. Charlotte, the second question is, I've got a lot of producers that tells me they don't have access to small ruminant veterinarian. So is there a list somewhere, or what would be your recommendation? That is the question I get most of the time.
Oh, where to find a veterinarian, or
where to find small ruminant.
Yeah, we're few and far in between still, quite a bit, but there's more and more new graduates that are coming out that are interested in veterinary or serving the small ruminant producers. It just depends. It's very geographical, unfortunately. When I was in practice, I had people travel all over the place just because they heard that I might be interested. And then that's what spurred me into going to extension years ago. And I traveled the entire state. And yeah, it's exhausting. I don't know what to tell them other than to talk to some of the large animal veterinarians or even the small animal veterinarians, because as the sheep and goats gain popularity for pets, especially like the little guys, little Nigerian dwarfs or baby doll sheep or whatever, people like to have them for yard ornaments. And so the small ruminant veterinary or small animal, I'm sorry, my granddaughter's not feeling good. So those veterinarians, even though they're not specialized in sheep and goats, if people could go in there and just talk to them, and if the producer, most producers know a lot more about their animals than the veterinarian does initially, so they can go in there and approach them and to help them learn and offer some of these resources. Like I used to give talks, and I used to tell producers, the best Christmas gift you could give your veterinarian if you really loved them is one of those books. They're super valuable, and if you've got a veterinarian you work with and you like and you want to grow that relationship, and you talk to them and they're interested but they don't have the confidence yet, But you could help grow that confidence by sharing one of those books with them, or just sharing the producer, sharing their knowledge with the veterinarian, and the veterinarian trying. I mean, that's what it's going to take, is they're just going to have to find somebody that they can work with that is at least interested. A lot of the older veterinarians, they already have their specialties. They want to just do cattle or horses, so it's going to take some of the younger veterinarians coming out of school, and they're a little more open to new ideas. I mean, I know when I was a new graduate, if it walked, I ended up working on it. I mean, ostriches, emus, everything. I touched everything. So
if a potential client brought me a pew, I would be so excited to work with their animals.
It's just, that's kind of how it evolved for me. I mean, I raised sheep. I've been involved with sheep, goats for a long time, even before I moved to Missouri. So for me, it was my passion. Pardon?
We also run into that with the poultry as well. Not a lot of veterinarians know much about poultry. And so educating your veterinarian or the veterinarian that you work with on your other livestock, educating them or building that relationship, and educating them as well on the poultry side in addition to.
Exactly. I used to have chickens too before I went to vet school. So fortunately for me, I was kind of familiar with a lot of different things. But, people brought me lizards and snakes, and I'm not a snake person. I don't do snakes. I don't advertise that I like snakes. But if they bring it into me, I'm more than willing to work with them on it. And, they could tell me exactly what to do. And I had a couple classmates that were into reptiles, so I called them and they talked me through it, or talked me down off the wall. But anyway, it's just, you got to build that relationship first with a veterinarian, whether it be your dog or cat veterinarian, maybe even. But build a relationship and then nurture that relationship by helping educate them and encouraging them to at least give it a try. Because a lot of it's just a lack of confidence. I don't have the greatest confidence with horses or cattle, but I'm not afraid to go out there and try at least. The best you can do is try. But I don't know how to make it easier for them. They're just going to have to go out and search for somebody, and that. But I do know that there's more interest in the newer graduates. I have them call quite a bit to see if they can shadow me, and I don't practice anymore, so there's no point in shadowing me.
Shelby's got a question.
Hey, Shelby.
Hi, great presentation. I was just curious because you mentioned it a couple different times, is how often are you seeing urinary calculi in your sheep and goats?
I don't see it as often as I used to, because it's a management situation and a nutritional situation. So if they are willing to change their management a little bit, but mostly it's a nutritional thing. So a lot of times it happens in the show animals because they're pumping them full of feed and they don't give them enough roughage. So you've got to learn to balance that roughage and not give them so much feed. And they're always worried they're going to get a hay belly on them, but they really won't if they exercise them enough and making sure they have plenty of water to drink. It's a balance, a nutritional balance, basically, but goats need a lot more roughage than people think they do.
Awesome, thank you. Yeah, I was just curious because I know it's a thing, right? But I hadn't heard of it being a huge problem, and that makes sense why.
I used to see a lot of it because people were getting into the industry, and for the show reason, because there was lots of money to be made on goats initially. And they would just pump them full of this commercial feed, show feed, and then hold off on the hay, just give them a little bit of hay. And it's actually the opposite. They need probably 2/3 of their diet has to be roughage, and 1/3 of it is pelleted mix. A lot of times you'll see it if you have a grain mix too, instead of a pelleted mix, because they can put the, ammonia chloride in the pellet, but they can't put it in a grain mix. So if people are feeding grain, which is common with dairy folks, it's all a lot, then they will probably have more issues with that too. And I made that mistake when I first had goats too. I fed them grain, and yeah, I had one get blocked, and that was awful. It was terrible, because you don't know that they're not urinating until they're so far gone that there's nothing you can do for them. So anyway, yeah, so I learned the hard way.
Well,
which is most of my education is the hard way.
honestly, I think I'm the type of person, I can't learn from other people's mistakes. I have to make the mistake myself. But once I made it, it's a great teacher.
College of Hard Knocks, and nothing beats it.
Very true.
Any other questions? How many people do we have stay on? Did we lose people?
Oh, we've still got most of the people that we started with. This
awesome.
is a great presentation.
Thanks everybody for hanging in there.
Yeah, excellent. Well, thank you, Dr. Charlotte, and thank you, Dr. Brenda. I appreciate both of you being here to talk with us tonight. Right now, I'm sharing on the screen. I've got our survey. We have a QR code. We also have a URL. The URL you can click on from the chat box, or you can use your phone to scan the QR code to be able to answer some of these questions for us. This is just our standard post evaluation. We will also send this information out as well in an email. We've got some upcoming sessions that we want you to keep your eyes peeled for. We've got Stop the Bleed in June. We have Feeding and Managing Pregnant Beef Cows and Heifers for Calf Success in July. We've got new vaccine technology coming in September, and Heroes to Hives in October. And then all of that is leading up to our in-person November 8th Pearls of Production. We're excited to have you. We're excited to see you. And we want to make sure that everybody gets a chance to keep in touch. So like I said, we will be sending out an email that has all of the links, all of the locations that we were talking about, all of the information that was mentioned in the session today. So if you attended the session, you'll get an email so that you can follow us on Facebook. You can check out our website so that as our new programs come on board, you can make sure to hear about them and be able to attend with us. So we still have just a couple more minutes if anybody else has any other questions. But again, I want to thank both of our speakers, and I want to thank everybody for being here tonight to be able to help us kick off this inaugural virtual session of Pixels of Production. So I'll hang on if anybody has questions, but at this point, I'll actually go ahead and put our survey back up in case you didn't get a chance to take a look at that. But thank you very much. Committee members, is there anything else that you want to add? I think that means we covered everything.
Hopefully.
Excellent. Well, again, thank you everyone for attending our inaugural Pixels of Production, and thank you again to Dr. Brown and Dr. Clifford-Rathert. So we had such wonderful presentations on small ruminants. And I think if we don't have questions, then I'll say thank you and have a wonderful rest of the night, guys.
Thank you. Good night. Bye.